Hello viewers, welcome to my channel. I am Puspen Dasgupta, an Indian ENT specialist, and I upload new YouTube videos at 9 p.m. Indian Standard Time every day of the week. And each day of the week subscribes to a particular theme. The theme for Tuesday, that is today, is MBBS ENT. When MBBS students encounter ENT, they are often overwhelmed because this is the first clinical subject that they encounter in their MBBS curriculum. Basically, clinical subjects are the real doctor subjects, just to be a little controversial. However, don't be alarmed. As MBBS students, you have read anatomy in first year of MBBS. In fact, anatomy is perhaps the most extensively read subject in the entire MBBS curriculum, and rightly so. Please don't be in a hurry to forget your knowledge of anatomy. If you remember anatomy, you can answer many difficult explain why questions. Explain why questions perhaps are the most difficult questions in the theory question paper because it requires in-depth understanding of a subject, and it is quite difficult to achieve in-depth understanding of a subject during MBBS because we are overburdened with lots of subjects and we have to remember each of them. To understand any one subject in depth becomes a challenging task. The easy way to achieve this goal is remembering our knowledge of anatomy. If you remember anatomy properly, many things can be answered easily. So keeping with that topic, we will discuss explain why questions pertaining to anatomy of larynx. We will discuss 5 questions today, starting with the first question. Now, a typical explain why question is asked in this manner. A statement is mentioned. Usually the statement is true and you have to explain why that statement is true. Okay, clear? Let's start with the first question. Saccule is known as the oil can of larynx. Now, if you have not heard of saccule, you will not be able to answer this question, but you can find an educated way of getting to it. What is an oil can? It is a can full of oil. What purpose do you think that can serves? It is full of oil, so it will help in lubrication. This means saccule helps in lubrication of larynx. How does saccule help in lubrication of larynx? Saccule contains glands that secrete mucus. That is how saccule helps in lubrication of larynx. That is why saccule is called oil can of larynx. Now, if you want to get more marks in this question, you have to draw a diagram, point out the saccule, describe the anatomy of saccule, and you will be good for this question. Moving on, the next question is posterior cricoarytenoid muscle is known as the safety muscle of larynx. Now, what do we know by this question? What do we understand by this question? There is a muscle called posterior cricoarytenoid and it is known as safety muscle of larynx. So it will play some role in safety. We have to understand what is the role or what function does posterior cricoarytenoid play in the body. Now, larynx has 2 kinds of muscles, extrinsic muscles and intrinsic muscles. Larynx has 6 cartilages, 3 paired and 3 unpaired. The paired cartilages are arytenoid, corniculate and cuneiform. The unpaired cartilages are epiglottis, thyroid and cricoid. Now, if a muscle has names of these cartilages in their name, say posterior cricoarytenoid, cricoid cartilage and arytenoid cartilage, chances are it is intrinsic because it is lying within the larynx. And intrinsic muscles of larynx largely have 2 functions, abduction and adduction. Posterior cricoarytenoid muscle is the only abductor. All other intrinsic muscles are adductors. Now, abductor will create a gap between the vocal cords. This helps in respiration. So, posterior cricoarytenoid muscle is the only abductor of the larynx. It helps in respiration and that is why it is called the safety muscle of larynx. I think that is quite clear. If you have any doubts, please feel free to reach out in the comment section below. The third question for today is laryngeal carcinoma restricted to glottis has the best prognosis. Now, this may appear to be a very technical question about laryngeal cancer, but all it wants to know is whether you know the anatomy of glottis or not. Now, clinically, larynx is divided into 3 parts, supraglottis, glottis and subglottis. For simplicity's sake, glottis is the part which contains vocal folds and glottis does not have any lymphatic drainage, practically no lymphatic drainage. That is why cancer restricted to glottis cannot spread through lymphatic route. That is why glottic cancer has the best prognosis because it cannot spread to other parts because it has practically no lymphatic drainage. Can glottic cancer never spread? It can spread through local spread. It can spread to the supraglottis and then it can spread through lymphatic drainage, because supraglottis has extensive lymphatic drainage, or it can also spread to subglottis. But if it is restricted to glottis, the cancer, then it has the best prognosis because glottis itself does not have any lymphatic drainage. Is it simple enough? So glottic cancer has the best prognosis because glottis does not have lymphatic drainage, so the glottic cancer cannot spread by lymphatic drainage. Okay? Compared to the other two parts which have lymphatic drainage, glottis has a better prognosis. Glottis cancer. Okay? Moving on, the next question for today is, why is there hoarseness of voice when there is a left lung pathology? Now this will not be asked in this manner. It will be asked like, a patient has left lung pathology along with hoarseness of voice. Explain why. So you have to understand what can cause hoarseness of voice or hoarseness. Hoarseness can be caused by a nerve cause, paralysis of a muscle, injury to a nerve, or injury to a joint. Okay, but this gets very technical. Let's focus just on nerves. Okay, which nerve is responsible for controlling the movement of the vocal folds? Largely recurrent laryngeal nerve. There are two nerves which provide motor supply to the intrinsic laryngeal muscles: superior laryngeal nerve and recurrent laryngeal nerve. Superior laryngeal nerve supplies only the cricothyroid muscle. All other intrinsic muscles are supplied by recurrent laryngeal nerve. So there are two recurrent laryngeal nerves in the body, one on the right side, one on the left side. Easy way to remember is left longer. However, why is recurrent laryngeal nerve called recurrent? Because it comes back. It goes to the thorax and it comes back to the neck. On the left side, it hooks around the arch of the aorta and comes back to the neck. On the right side, typically it hooks around the right subclavian artery and comes back to the neck. Sometimes on the right side, there is something called a non-recurrent laryngeal nerve, which does not go to the thorax. It is a horizontal branch directly from the vagus or the 10th cranial nerve. In that case, it is the horizontal nerve, horizontal course. It is not a recurrent nerve. So it is non-recurrent laryngeal nerve, typically seen only on the right side, never on the left side. So you know about the arch of the aorta because you've read about it in first year of MBBS. You know about the arch of the aorta, you know about the right subclavian artery. Which lies lower in the body? Which lies more inferiorly? Of course, arch of aorta. So left recurrent laryngeal nerve has to go up to the arch of the aorta and then come back. So naturally, left recurrent laryngeal nerve is longer and it is coming in contact with the lung. If there is a lung swelling or a lung pathology, it can compress the left recurrent laryngeal nerve and it can produce hoarseness. Okay? So lung typically has no role in causing hoarseness directly. What it does is the lung pathology can compress the left recurrent laryngeal nerve, which can interfere with the mobility of the vocal fold, and that in turn can lead to production of a hoarse voice. Is that clear? Again, if you have any doubts, I am more than willing to answer your questions in the comment section below. The final question for today is, why do we see vocal fold nodules in singers? This is also an answer that you can get to just by knowing the anatomy of larynx. Now, vocal folds typically have two parts. There is the membranous part, which is also known as the phonatory part, and there is the respiratory part. The anterior 2/3 of the vocal fold is the phonatory part, and the posterior 1/3 of the vocal fold is the respiratory part. Now, when you are speaking, especially if you are singing, then a lot of stress is placed on the vocal fold. Which part of the vocal fold? The anterior 2/3, the membranous part of the vocal fold. Now, when this stress is placed on the vocal fold, the middle part, the midpoint of the membranous part of the vocal fold is where the maximum strain happens. This is the typical location of the vocal fold nodules. So vocal fold nodules are typically located halfway in the membranous part, and membranous part in turn is only anterior 2/3 of the vocal folds. So if you take the entire vocal fold length into consideration, then vocal fold nodules are typically seen at the junction of anterior 1/3 and posterior 2/3 of the vocal folds. typically seen in people who professionally use their voice like singers and teachers. So again, all of these explained by questions could be answered simply if you knew about anatomy of larynx. If you have any questions, please feel free to reach out in the comment section below. I'll be happy to answer your questions. If you found out any mistakes in my explanations, please don't hesitate to point it out. I'll be more than happy to learn from you. Thank you so much for watching this video. Take care, bye bye, and please don't forget to be awesome.